Welcome back. So President Cyril Ramaphosa is challenging a court ruling that the National Health Insurance is reviewable. Ramaphosa and Health Minister Aaron Motsoaledi have approached the Constitutional Court. Last year, the High Court ruled in favor of the Board of Healthcare Funders and the SA Private Practitioners Forum. The President was ordered to give reasons for signing the bill. But let's discuss this further. For that, we're joined by Professor Prof Kredo from the South African Medical Research Council. Thank you so much for joining us, and a good morning to you. This is a discussion that goes on for many years, but now, Prof, it goes all the way to the Constitutional Court. The President wanting the Constitutional Court to look at the Gauteng High Court declaring that NHI is reviewable. What do you think of the steps taken by the President and the Health Minister?
Thanks so much, Naledi, and it's great to be here. Look, I think just to declare, I'm not a legal expert. I work in health research and health systems. And I think we all recognize we live in a constitutional democracy. The courts need to take their course. However, I think we've seen several times how we're concerned sometimes where there are delays in addressing kind of these judicial processes. That kind of, let's say, they degrade public trust sometimes. So we want to see that this process can proceed, and we want to see reforms in the health system, more importantly. There's been a lot in the news about the complainants and what's unfolded. However, I think most of us, we are more committed to the broader issue of how do we improve health systems and health sector delivery? How do we make sure that people get the best available care at prices they can afford? And so we don't want to see this issue mired in legal battles. I'd love to see some form of mediation and a mature progressing of this situation so that we can proceed to reform the health system, which is something we absolutely do need to do.
Yeah, I mean, let's talk about how we get there, because, again, I mentioned this has been an argument and a debate that's been going in South Africa for a very long time. And what wonders, from a governance point of view, whether some of the blockages are going to be within the government of national unity, but perhaps not an issue for you, but strategically what needs to be done then to see this reform? Because NHI needs to be reviewed, that's one point, but what needs to be put in place?
100%.
Yeah.
So NHI is a long-term vision, and the funding mechanisms and how much it will cost, those all are still unclear. In the meantime, we are sitting with we come from this long history of inequality. We remain in this inequitable system, which is reflected and in some ways perpetuated by the private and public sector systems. And we don't want to see that carrying on just as is, or even more inequity growing. So there are some things that we need to be doing. We need to improve our health information systems so that whichever facility you go to, you should be recognized, you should have kind of interoperable data. And I mean, there's so much we should be tapping into globally that's happening in this space. From the space that I work in specifically, have a very close, so those of us that are doers, the technical people working on things, we have a wonderful collaboration with the colleagues working on national guidelines. So guidelines are things around how do we treat HIV, how do we treat diabetes. I know everyone's very interested in that HIV, prevention medicine, or the diabetes medicine like Ozempic. I don't usually use trade names, but so I think what we want to see, what we have in this collaboration, is that we're exploring how do we strengthen governance at the decision-making level within government. And that is happening now, regardless of the NHI Act and how it is implemented. There are reforms happening at the moment. There are committees coming on board, managing things like how do we manage interests so that we don't have people with commercial interests making decisions, or academic interests for that matter. How do we have transparent processes that can be put in the public domain? And I think a really exciting piece of work that our evidence to decision collaboration is working on is how do we get authentic patient and public engagement in the decision space? So, with all the legal battles happening, there is other work happening behind the scenes to see how do we strengthen governance and systems at the healthcare decision-making level that will inform the reforms that happen later. But there's a lot we're doing now already.
Yeah. Again, the president saying that, and this issue of him and the health minister approaching the Constitutional Court, he says that his concern is that if there is too much questioning of his decision making, this is going to harm some of the obligations that he has as head of state in an issue as serious as health matters in South Africa. Again, and this is just to close things off here, Prof, is the president listening, right? So the South African Medical Research Council, for instance, has the platform been given to organizations such as your own for your perspectives to be heard?
So I mean, I think just speaking from the research perspective, there was that very substantial consultation with the National Council of Provinces. And when you review all the submissions and what amendments were made, we can see that despite some big concerns, for example, around centralizing of power, issues around community participation, I think we've seen that we didn't see substantive changes to the NHI Act when it finally was signed. And I think that's part of the issue here that we're seeing. So I think people do need to account for how, when you have a consultation, how do you make sure that it's authentic, and that if there are changes, how those are shown, and if there are no changes, how is that rationale really communicated so that we don't end up in these legal battles?
Yeah. Prof, a pleasure. Thank you so much for your time. Professor Prof Kredo there from the South African Medical Research Council. So, scholar transport operators in Potchefstroom in the northwest of